Thank you for joining us for this telephone call tonight. It's our first telephone town hall meeting on health reform, healthcare reform, and it's our first time trying this new technology, so bear with us. But we've made thousands of calls to Alaskans simultaneously, and thanks for staying on the line during your dinner break so we can get to some important issues here facing the healthcare system and healthcare reform. It's also, as you know, I'm traveling back and forth, and I'll be back in Fairbanks on September 26th for those folks that are from Fairbanks at 11 o'clock at the UAF Scheibel Auditorium doing a town hall meeting on healthcare. We've done one in Anchorage, we've done one in Juneau, and we're going to do one again in Fairbanks September 26th. Just watch our website to get more information on that. Let me give you a brief update on healthcare and what's going on here in Washington, D.C. Then we're going to just open for questions, and we'll try to get through as many as we can within the hour here. First, you probably saw some of the news. There was a big rush to get a bill finished before our August break, which would be August 8th, but Majority Leader Harry Reid indicated that we would not do that. We would spend more time trying to make sure we do a very solid bill and spending time with the public as much as possible. So the August break would not occur, or the August break would occur, but we would not vote on a bill prior to that. On the House side, they want to try to get their bill done. They've gone through two committees. They hope to finish out the third committee. Once they do that, then it will move forward to the House floor on the other side. We have been very busy here on the Senate side. We have one bill that's been produced by what they call the Health Committee, the Senate Health Committee, which is the Health, Education, and Labor and Pension Committee. The second bill is coming out of the Finance Committee. That's the one that has the most discussion. A lot of people wonder why it's coming out of the Finance Committee when it deals with health, but it's because it does the financing of and how it's going to be paid for. Senator Begich, a group of us freshmen, more moderate freshmen, have sent a letter to Senator Begich, who chairs the Finance Committee, made it clear that we truly want to see true reform where it drives down the cost at the same time that we have a good, strong financial backing in order to sustain it over the long haul. We sent that recently to Senator Begich, indicating, again, a group of us 8 freshmen are concerned about the long-term sustainability, but we want to see a health care bill developed, but we want to see it on a very solid financial footing. Now, I will tell you, I want to kind of lay out just a couple points and, again, go right into questions. And this is more Alaskan-oriented, why we are heavily focused on reforming the healthcare system as well as reforming the insurance industry. 1/6 of the national economy is devoted to healthcare costs. 116,000 Alaskans are without health insurance. Truly, that's 1 out of every 6. The cost of uncompensated care, and what I mean by that is if you're paying insurance today and you are paying your premiums, doing everything that you need to do, about $1,900 of that premium cost each year is going to pay for uncompensated costs, meaning people who don't have insurance, you're paying for them now to the tune of about $1,900 a year. One other data point, 62% of all the bankruptcies that occur in this country are caused by people who are unable to pay their health care costs. And of those, interesting to note, 75% of them have health insurance. So even people with health insurance are finding themselves in financial hardship, and that's why health insurance reform is also important part of this package. Let me just lay out some quick parameters, and then I'll end, and we'll go right into calls. First thing is, and I know there's a lot of talk out there of what this bill or what bill would do. There's multiple choices that are being discussed right now, but the first thing is, that is critical is that if you got a doctor now, you got a medical professional you want, you get to keep that. If you have an insurance program or a health care policy you want, the idea is to make sure you keep it, that you can keep who you want, that we keep that patient-doctor relationship very strong. Pre-existing conditions is a principle that must be in all healthcare reform, that no matter what pre-existing condition you have, that you can be covered and that you can have portability between employer to employer. Also strengthening our veterans as well as our Indian Health Services are also important. And the 2 other last pieces I'll mention is ensuring that prevention and wellness is a critical piece. and that the small business community also has the opportunity to receive access to affordable health care for not only their themselves as entrepreneurs, but also their employees. It is clear by a data report we laid out recently that if we don't do this, especially around the small business community, it is estimated over the next decade by doing nothing will be about $100 billion cost to the small business community, which just means we all pay for it one way or another. So healthcare reform is important. Health insurance is important to do reform. We're going to take the time necessary to do it right, making sure it's affordable. People have choices, and that who you have as your doc is not taken away from you, and that pre-existing conditions are covered no matter where you go. Let me end there, and we'll just start going through questions. I know Max is going to kind of manage that, and we'll get those questions as they come through.
Thank you, everyone, for joining us again. If you have questions about health care, please press *3, and a member of our staff will help you forward your questions to the Senator. To begin, we're going to join with Francis Mitchell from the Graph.
Hello, Senator Begich. I agree with all of the points that you have made, and I'm glad that you're supporting those points. I also think that the government has a legitimate role in health care insurance and in certain realms of public policy and finance, and privatization of certain things has gone too far in some areas, and I'd like to see for sure that there is a public option in the health care reform, in the insurance options. Do you firmly support that?
Let me tell you on public option, and there's a couple things out there. There's public option, there's co-op. Do I believe that there's an opportunity out there for us to kind of equalize out the cost for insurance companies and their premium program? Yes. Have I decided on a specific public option or a co-op? No, I have not, because I think there's multiple ideas floating right now. And matter of fact, we're working on an idea we'll probably put out in the next week or so, which will lay out some other ideas on how we can create, again, more affordability, more access. So I have not made my final decision in regards to that, but I'm looking at many different options that are out there, and the co-op idea is a very new one. There is some discussion in finance on that, and the co-op idea is, if you can imagine, if you're a member of a credit union, it's a very similar concept where it's member-owned and driven that way rather than some private company profiting. It's a nonprofit driven. So I'm looking at all the options in front of us at this point.
Our next question will be coming from Thomas and Homer.
Hello?
Hey, hello.
There we go. You're on.
Okay, thank you very much. My name is Tom. I'm in Homer, Alaska. And what I want to know is we already have some government sponsored programs for our government employees.
Yes.
We have a government program for veterans. We have Social Security. So why don't we, until you guys get this thing worked out, why don't we have a moratorium, and if you guys can't work this thing out, we scrap your program that you have insurance with, and we start all over. And I would like to hear you guys give us a promise that you'll get this done, or you will do something different.
Yeah, Tom, your question is a great question, holding our feet to the fire. Here's one idea that I've talked about during my healthcare forums, both in Juneau and Anchorage. I intend to propose an idea. Currently, the federal government employees, we belong to a federal insurance program, competitive, very competitive in the rate structure. We get to negotiate with different insurers all across the country. We have 4 million federal workers in it, and of their dependents, it's close to about 8 million. One of my suggestions has been we should open that program up, allow people to buy into it, just like you would go out and buy insurance. But the difference is, because we have such a large bulk of people, 8 million already covered, we're going to get the best rate, and the benefit of that is going to be passed on to individuals. And what I've suggested is those that don't have insurance today and those small business businesses could buy into this program. I think it's a fast way to get affordable, accessible health care. And my attitude is if it's good enough for us, it should be good enough for anyone else. And so in reverse of your statement, instead of us saying nothing, we will cancel ours, we should just open ours up and just get as many people into that program. It wouldn't cost the government a dime because the program exists now and you would pay the full premium. The only difference is we might offer a tax incentive for small business people to enroll their employees, so there's a tax credit and lower the cost for those employees. So I agree in principle that our program is a good one and we should open it up and create more access to people. I've advocated for that and probably will be a lot stronger with an amendment or legislation in the very near future.
We'd like to thank everyone for being on the call again. Senator Begich is currently answering questions about health care. If you have a question about health care, please press *3, and a member of our staff will assist in forwarding your question to the Senator. Our next question will be coming from Fred Selah.
Hello, Senator.
Hello, how are you? Thanks for calling.
Well, thanks for having this.
Actually, I called you.
Well, as a matter of fact, you did. But my question is, and I guess the way I feel about this is that we can eliminate a lot of separate entities, VA, Medicare, Medicaid, not the least of which would be workman's compensation, by just adopting a single-payer health care plan. It's what they call socialized medicine in a lot of countries that really like it. So that's my question. How do you feel about that?
Yeah, I have not supported a single payer, and here's the reason why. First off, the political will of a single payer just doesn't exist here in Congress, and we have to deal with the reality of, do we want to get a reform to health care, ensuring that people can get their pre-existing conditions covered, making sure that their insurance and their health care is portable, making sure they have their doctor choice and health care choice, and single payer doesn't have the political wherewithal at this point here in Congress.
Not to interrupt you, but this is a House Bill 676 with 93 co-sponsors.
Yeah, that's out of 400. I hear you. 93 co-sponsors out of 435 on the House side. House is a lot more, to be very frank with you. The politics of the House is a lot more liberal, and getting it into the Senate is very difficult. And I can tell you, Bernie Sanders, who is probably the biggest, I just had dinner with him just about an hour ago. Just to give you a bearing, it's about 10 o'clock here, Alaska or D.C. time, but just had dinner with Bernie Sanders, who is as the biggest single-payer advocate you can imagine on the Senate side. But even he has recognized the politics of how to get something moving is going to be very difficult. And he's like me. We want to see something move forward because there's so many not covered, as well as so much underinsured or undercovered. So that's why I'm looking at these other options, co-op, public option, those as an option out there. But single payer just doesn't have the political horsepower right now, just to be very frank.
Our next call will be coming from Tony in Anchorage. Tony?
Hello, am I on?
Yes, you are.
Hi there, how are you? My question is, and I appreciate the call, why does Medicare and why do these programs include people who are extremely wealthy? My mother, for instance, who could very well pay her own medical, uses Medicare, and I don't think she should.
Well, on Medicare and Medicaid is all income driven, but Medicare is a granted benefit after the age of 65, and it obviously becomes your primary. But there is discussion. You're absolutely right, and that's the issue around how and who should receive that. And the issue of saying because you make so much, we're not going to have that into the mix, I think is going to be difficult. Now, saying that, there is discussion, and I know under Medicare, depending on your income levels, there is a copay up to a certain amount. But I would say that is, being looked at aggressively, because the idea of Medicaid is to pay for those under low income, but Medicare is to ensure anyone over 65, originally set up, would be covered as their primary insurance. But when we, under the whole insurance reform that we're doing now, we're going to look at the whole picture, because it's so much of our economy. We have to figure out how to balance this out, or it will honestly, I know a lot of people are concerned about the deficit. This will drive the future deficits of this country if we don't get this under control, because it's having an impact to the private sector, and the public sector, and everything's being looked at. So I would say the Medicare component you're questioning is on the table to be discussed. What that means, hard to say.
We'd like to thank you if you're just joining us. Senator Begich is live and taking questions about health care. If you have a question about health care, please press *3 and you'll be directed to a member of our staff that will assist you in forwarding your question to the Senator. Our next question will be coming from Charles in Sitka. Charles, you're live.
Yes. Good evening, Senator.
Yes.
The question I have is deals with the insurance that the state of Alaska has for past employees, retirees. And I wonder if there's a new policy that you people are looking at in Washington. Have you read 1,017 pages, already of it? And number one, and two, will it affect the policies that we have with the state of Alaska?
Yeah, here's how it would work. First off, I want to say that the House bill you're referring to, we're starting to review the process now. I've made the commitment when we have a Senate version of the House bill, I'm going to spend the time to review it and read it with my staff. We're not going to just pass it blindly in the night. That's not the way I intend to do the business on a pretty significant piece of legislation. The second thing is, if you're retired and you are not Medicare eligible at that point, your PERS or TERS, depending on which one you're in, will cover your health care costs. Once you turn, and this is how it is now, it doesn't matter with reform or not, once you turn Medicare eligible, Medicare becomes your primary. That's existing, and that's not anything new. So this doesn't contemplate any change to the way you are currently receiving. And so that's the way it's being done at this point.
Our next call will be from Joe in Anchorage. Joe, you're now live.
Yeah. Good evening, Senator.
Yes.
Can you hear me? Okay. Yeah,
yes, I can.
Okay. Big question is, I've been reading the emails from President Obama and to support this plan, and I agree with some type of reform, but I just don't see any details as to how we're going about paying for this. And if you could shed some light on that, that would be great.
Excellent. Well, thank you very much, Joe. And if I can, I'm going to jump back for a second. Charles had a question just before. I want to make sure the House or the Senate bill by the HELP Committee, it's a pretty significant bill. They are still reviewing it. It hasn't been fully printed yet, so no senator outside the committee has fully reviewed that. Now, Joe, to your question on paying for it, that's the big hurdle, to be very frank with you. And we are struggling with what's the right way to pay for it. We anticipate about two-thirds of the bill, at least the HELP Committee's bill. Remember now, there's not a Finance Committee bill. There's not a final bill in front of the Senate, so we can only work off of some of the bills that are in draft and those that are completed. And about two-thirds of those costs have been dealt with through the drug companies, the medical, the hospitals and others, and how they can reduce some costs down. The other piece is prevention and wellness. It is clear that we can calculate a value for that, but that is yet to be fully calculated into these bills that are being drafted and or passed through these committees. The other piece, at the end of the day, is there will be a cost. And the question is, what's the right way to pay for that? There is no single decision on that. I don't support, for example, there was an idea of taxing benefits over a certain amount of money. I don't support that. I think that would be the wrong approach. There have been some ideas on some additional taxes on the income levels, and one was for $250,000 and above, which I didn't support. So we have a long ways to go, and that's where the struggle is, to be very frank with you. We all recognize in the Alaska experience, if you're paying, and I'll just use a hypothetical based on some reality, and that is if you're, say, a city employee, and I'm a little familiar with this in Anchorage, and we have maybe $12,000 in premium costs, almost $2,000 that is paying for the uninsured today. In other words, that cost is being absorbed right now, so we have to account for that. But there is no final decision on how we're going to pay in the final, and that's where I can tell you the 8 freshmen Democratic senators have sent a letter to Senator Begich, the chair of finance, and stressed that concern that we want to have a thoughtful, sustainable, no gimmicks, no playing the game, and how they're going to figure out the cost and be very frank with the voters that we have to resolve this in order to sustain health care in the long term and sustain this economy.
Thank you again, everyone, for joining us this evening. To ask a question about health care, please press *3, and you'll be forwarded to a member of Senator Begich's staff that will take your call. If we are unable to answer your question this evening, everybody will have the opportunity to leave a voicemail message for the Senator, so please feel free to stay on the line. Our next question will be coming from Karen in Girdwood. Actually, Karen just left us. Our next question will be coming from Ed in Anchorage.
Hi, Mark.
Yes, Ed, how are you?
How are you doing? I'm calling from your apartment 16.
Oh, well, I was just there this weekend in 24 looking at it. So
Small world, huh?
Yeah.
I have been working as a medical biller. As a matter of fact, I'm a Medicare Medicaid specialist. Been doing that for 7 years, and I can tell you from experience, Medicare is broke. I mean, the way they do business is broke. Are they actually? My original question you kind of answered was, are they still considering taxing the health care benefits of the working class? So you kind of answered that, but I'd like a little more in depth.
Sure.
That's still part of what they're doing.
Well, let me say on taxing, why don't you ask your second part because they'll switch to another caller at the same time. But once you taxing benefits, I can tell you, I'll answer that. And in the Medicaid, Medicare, I'll respond to the broken system if you'd like me to do that, Ed. Let me say this. On taxing the benefits, that seems to be off the table at this point. There's a group of us that have been pretty strong about that would be a huge mistake. And, some people, the thing that you have to always watch in the press and how it's reported, a Democrat senator mentioned the idea, and before you know, it's all portrayed as the Democrats' idea. Well, that's an individual, not representing any party or any group. I'm a Democrat, but I don't support it. I think it would be a mistake to tax the benefits of an employee. The second thing is on Medicaid, Medicare, you are absolutely right, and you probably see it firsthand, and that is where the system has broken down in the sense of delivery and how they manage for some efficiency. We know there is millions, in some cases billions, in Medicaid, Medicare fraud that can be dealt with. I know in this bill on the Health Committee has produced, there's some stronger efforts to go after Medicaid and Medicare fraud. We estimate, there's hundreds of millions of dollars in that category where people are fraudulently billing or lack of follow-up to ensure those dollars are spent correctly. So it's a combination. That's why when I talk about health care reform and health care insurance reform, it is truly reform. It's not only making sure we cover people who are uninsured today, ensuring that the affordability and access, but making sure the system is more efficient in its delivery so we are not spending for a dollar we're spending, we're wasting a portion of it. So, Ed, you're right, we do deal with it, but honestly, in the health bill that came out of the Health Committee, I don't believe they've done it strong enough, and some of us are working hard with the Finance Committee to make it stronger.
Thank you again for joining us. Senator Begich will be answering questions for 20 more minutes. So if you have a question about health care, please feel free to press *3, and you'll be directed to a member of his staff that will take your call. Right now, we'll be going to Martha in Anchorage. Martha, you're now live.
Hi, Senator. Hello.
Yes, I'm here, right here.
Oh, there you are. Okay, hi. This is also about Medicare. I was a retired person, and probably one of the lucky ones. I have both Medicare and a very good secondary insurance.
Good.
The state of Alaska. But my question is, when the doctor drops Medicare, which many of them have here in Anchorage, as you know,
yes.
You cannot say, please stay with it, and I'll pay you the balance of what they don't pay you. Well, that's not possible. So he has to drop it. From there on, I cannot use my secondary insurance when I go to see him.
Right.
Now, that's a problem. And I wonder if that's being worked on at all, because it is kind of it's not a problem for me as much as it might be for some people that are on a little bit lesser retirement.
Yeah, no, your point is something I talked about during the campaign, that there's a couple elements. One is the Medicare reimbursement rates need to be adjusted and need to be dealing with the current pricing that's out there. Second, people should be able to pay the difference if they want to between Medicare and the cost of service. And the third thing is we are finding more and more, and Alaska is at the tip of the iceberg. So when I explain it to people around Washington, D.C. here, that people don't understand that there's a lot of doctors who are, I don't want to say the words, and it's strong, but it is the fact they're refusing Medicare patients. It's only because the reimbursement, the cost, and administration costs are pretty exorbitant for them. And so one of the things we have to do is streamline the process, make sure reimbursements are done well, let patients pay the difference. And the fourth is making sure that we spend some time bringing more people into the profession of general practitioners, which is a huge gap within the healthcare system. That will add some more docs to the end, and meaning that we will have some access to more docs that might take Medicare if we can work out with regards to their loans and other activities. So there's clearly, that's part of the discussion down here. It's a huge, huge hurdle because of the cost, but there is no question in our minds that has to be dealt with. You cannot just have a new healthcare system and then forget about the ones you have in place without doing reform and ensuring that they're managed efficiently.
Thank you again for joining us this evening. As a reminder, if you're in line to ask Senator Begich a question and we're unable to get to you this evening, you will have the ability to leave him a message. So please stay on the line for the opportunity to share your thoughts with Senator Begich. Our next question will be coming from Janet in Palmer. Janet, you're now live.
Hi. My question is this. I'm concerned that my family will end up paying more for insurance after the government implements the plan. What I hear is that I'll be able to keep my insurance, which is great. But what I also hear is that I'm going to pay more to help this new plan, so I get to pay for my insurance and someone else's. So is my family going to end up paying more for insurance and the new plan?
Thank you very much for that question. And right now in Alaska, you are, as an insured individual, paying about $1,900 of your insurance right now goes to pay for those uninsured. And that is, and it's hard to imagine that because people assume that, oh, well, I'm paying my insurance, that's the way it is. Well, the uninsured, when they go to a hospital and get service and they don't pay for it, they work that into the cost, which then in turn we all pay for as insured people. So we're paying $1,900 now. So the question is, will you individually as a person or a family pay more? To be very frank with you, that's hard to determine. Depends on what plan you take. We believe, and again, I say we, there's a group of us freshman Democrats, more moderate, that want to bend what we call the cost curve. The cost curve has to be bent in the right direction, meaning lowering the cost or stabilizing the cost. Because one of the things you're going to face if we do nothing, if we just leave it as it is today, and we keep the uninsured, we keep the programs running as they are now, then I will guarantee you, I will put money on it. I will make the bet with you. In about 3, 4, 5, 10 years from now, clearly you will be paying significantly more. Some estimates in some communities right now, it's 18% of our economy. That will be much higher in the future. So you're going to pay more and significantly more if we do nothing. The cost of doing nothing is huge. And what we have to figure out how is reform it, make it more efficient, at the same time introduce wellness and prevention. And I'll give you one example. As mayor of Anchorage, when I came in, we were facing 12, 13% premium increases every single year. We introduced a kind of a mixed package between private and in-house controlled insurance. We had a wellness program, a prevention program. When I left as mayor, the price or the increase in premium was only 0.5%. So it's very important that we do something, or you as the insured and as me as the insured will pay significantly more in the future.
Thank you again for joining us this evening. Our next question will be coming from Peggy, who's also in Palmer.
Hi. I'm just wondering about the accountability of patients, i.e. the smokers and the overweight, the smoking moms whose babies end up in the NICU. Is there any talk about making patients become more accountable? And then I also want to know if there's talk of any caps on these frivolous lawsuits.
Let me answer the second question first. There is some discussion on the caps on lawsuits. I don't know if that will go anywhere, when you look at the numbers, it's a very, very small percentage of the cost of healthcare delivery. But the second piece, you are singing to the choir with me, and that is when you look at chronic illness, which is the biggest driver in increased costs, basically illnesses that people can handle and deal with. Smoking is one example. My view is I'm a non-smoker, and I have someone maybe next to me who might be smoking. Why should I pay the same premium as they are? I should get an incentive for living a healthy lifestyle, because here's one of the things that's going to drive down health costs. It's not just about reforming the system, reforming insurance, ensuring that we have an efficiency in the system. We have to drive it down by people have to change their lifestyles and be healthier, because the biggest expense and growing cost to healthcare is preventable diseases, preventable illnesses, and you hit it right on the head. So yes, absolutely, that's a significant discussion point within the healthcare discussion down here. It's something I'm advocating directly on, that people who live unhealthy lifestyles like smoking and preventable diseases, there should be an incentive for those that are not living those unhealthy lifestyles. So I could go on for a whole hour on that one, but I won't.
Senator Begich will be taking questions on health care for 15 more minutes. If you have a question about health care, please press *3. If you're currently waiting to ask a question, please remember that you will have the opportunity to leave the Senator a voicemail, and all comments will be sent directly to him. Our next question will be coming from Charles in Big Lake. Charles, you're now live.
Come on. Hello, Senator Begich.
How are you, Charles?
Not bad. How are you? My question is, I'm a small business owner, and my question is, are we as business owners going to be forced to pay for our employees' benefits?
Yeah, thank you very much, Charles, for that. Someone who's been in the small business world for many, many years. My wife owns 4 small businesses. Under the current Senate Help Committee bill, and then again there will be one under the Finance Committee, if you're a small business with 25 or under in the amount of employees, you will not be forced into any program. Second, the discussion of raising that number is being discussed, because to raise that potentially to 50 and under, that would not have to bring in health care. But let me put aside that for a second. Again, we're watching very carefully the small business component. My view is this in the small business world, that a lot of the small businesses community, they're the largest employers in our country. They're the fastest employers in the sense of bringing people back online as the recovery starts to occur. What I hear from small business people, they want to have access to health care. They want to be able to opportunity to provide it to their employees. The problem is they only can buy in these small groups, so therefore their premiums are very, very expensive. My brother-in-law pays around $450 a month for a $15,000 deductible. That's just outrageous when you think about it. He's a small business entrepreneur. So my goal is to make sure that small business is not negatively impacted, that we get access for small businesses, so if they want to provide health care for their employees, they can, and along with that, a health tax credit, meaning you provide health care for your employees, you will get a tax credit to a certain amount, therefore offsetting that cost if you choose to do that. But right now, it's 25 and under. Amount of employees do not have to provide. There's discussion to raise that to 50 and under.
Our next call will be coming from Mary in Homer. Mary, you're now live.
Hi, Senator Begich. My name is Mary Lou. I'm a nurse midwife in Homer.
Yes.
My husband and I have a private practice, medical practice, and I applaud your efforts to reform healthcare insurance. We're really hoping that it becomes simplified in some way for our patients that do not have health care insurance. And the public option, we support that. And wonder if there's any, I know that they haven't come up with a specific public option, but certainly there's precedent with other Indian Health and VA and other programs that exist in our country. And we wonder, would there be any effort to include dental coverage and pharmaceutical coverage? And we also have questions about whether there's any discussion of malpractice insurance reform. Thank you for your effort.
Yeah. Thank you very much. Again, on the last one, malpractice insurance reform, there is some not significant, to be very frank with you, because they've done the numbers and it's a small impact to the overall cost of medical coverage. But talking about dental and pharmaceuticals, but clearly dental, I know my mother just dealt with this in Medicare. You know, Medicare does not cover dental and certain procedures, pretty significant procedures you need when you're a senior, and that's come out of your pocket. Very expensive. But there is absolute discussion of dental services. I know there is some efforts on how to ensure that we have the right people working in those fields. Again, making sure we have the supply of folks to provide those services. But clearly, there is some discussion and strong interest in making sure when you talk about health care, it's the holistic look at someone's health care needs, not just elements of it, which later then some portions aren't covered. So looking at the whole picture. Because this is, and I guess I will just emphasize again that, 18% of the economy, of the nation's economy is healthcare, and we must get a handle on this, that we work to create better programs that focus on wellness and prevention, on outcomes, not just how many patients you see and how many times you see them, but on what the outcome is. And there's a lot of great doctors and nurses and practitioners out there that have been giving me some great ideas on how to reform the system to be more responsive to the patient's needs. And it is about, again, the holistic look, and that is not only about pharmaceutical issues, but also about dental care and full medical coverage.
Thank you again for joining us tonight for this call with Senator Begich. If you'd like to ask Senator Begich a question about health care, please press *3 on your phone, and a member of his staff will assist you in forwarding the question to the Senator. Our next call will be coming from Sandra in Wasilla. Sandra, you're now live.
Good afternoon or evening for Governor Begich. My concerns is, I hear people talk about, basically that people are costing $1,900, the average person. A lot of people can't help the fact that they're disabled or whatever. And, I've seen abuse being on Medicare, Medicaid so many times, and I've even tried reporting it. We do need to make more stringent, laws as far as how these doctors are billing, because I've, tried to discuss two things with a doctor and been told I have to make another appointment, which costs another time and more of his, more of our government's money. And there's got to be a guideline that needs to be followed to prevent a lot of the fraud.
Yeah, you very good point, and that's one thing we've tried to focus on. Again, with the issue with fraud and billing practices, I think we have some ideas that are going through these bills to streamline that and also stricter enforcement. But on the issue of your point, which is a good one, where you've called back to get additional assistance from the doctor and they want to set up another appointment or another appointment, what's clear is if we can refine the system to focus on outcomes versus how many times a doctor sees a patient, the benefit will be much more significant to the patient, and we believe it will drive the cost down, because instead of focusing on, geez, you need to go 5 times, instead we rather you be healthy and it only may take you 2 times. So that's a big discussion. I have to tell you, that's a big shift from 15 years ago to where we are today in reforming the medical system, because now people really see there's good data points. And I'll give you one example. The president of Safeway Company talks about how he focuses on outcome versus how many times you see a doctor, and tries to work to help people live a healthier lifestyle. Example, if you're an obese individual, you might see, and this is his group of people, his Safeway employees, they will see a medical professional 10 different times throughout the year. If you're not obese, it's 1 time per year. So he knows by developing more wellness and prevention, helping people get a healthier lifestyle will save money, and the docs will be more focused on outcomes versus how many times you visit. So that principle that you mentioned of your personal situation is exactly where we're trying to go.
Our next call will be from John in Anchorage. John, you're now live.
Hello, Senator Begich. Good evening. there was an editorial in the Anchorage Daily News recently having to do with the way hospitals compensate physicians. And currently, physicians are compensated in part in terms of the number of tests that they order, which is an incentive for physicians to order tests, which is one of the reasons why hospital costs are going up and up and up. And the hospitals are the major economic detriment. And the editorial suggested that if physicians were compensated hourly, rather than, no matter how high it is, rather than the number of tests that are ordered, that would remove an incentive for ordering a maximum amount of tests, many of which might be unnecessary. Is there anything in either the House or Senate bill addressing that?
There is, I know, in both of the bills, but also in the discussion in the Finance Committee on just that main principle, and that's outcome-based versus procedures. And it is one of the things when you look at some of the data that we've seen that there are many times, I shouldn't use the phrase many, I should rephrase that and say there are times when there are x-rays and other types of procedures that are ordered or tests that are ordered that may not be necessary for that patient and therefore drives the cost up. It's why President Obama, and I know Senator Begich from the chair of the Finance Committee met with the hospitals to work with them to drive down some of these costs and get some more responsibility on their part, and that is really a big target. So again, I can't emphasize enough, it seems to be a good theme among all the callers today, is that, you know, we are focused on the same thing what we're hearing, and that is get to the point of getting outcomes versus just how many times a doc sees a patient. And again, I want to emphasize the point too that the docs and nurses that I've been talking to have given me some fantastic ideas on how they want to see the system changed, because they came into practice in the area of medicine for the benefit of the patient, and they're caught up like everyone else in this system that needs to be reformed and changed to better get to the focus of providing health care, not just passing paper and getting how many tests you do each day.
Thank you again for joining us this evening. Our next call will be coming from Ann in Anchorage. Ann, you're now live.
Hi, Senator Begich. My question is, how did this all become such a crisis? What's happened like in the last 10, 15, 20 years when things all of that seemed to be a lot more smoother and well organized and a lot less expensive? What's happened to make it so expensive and become such a crisis these days?
Yeah, that's an interesting question, because that's one that I get asked a lot. And here's how I view it, and I'll just see it from my 6 months being here in the United States Senate, but also being the former mayor managing healthcare and then being on the Anchorage Assembly and having to deal with healthcare costs. The cost of healthcare over the last half a dozen years or maybe 8 years has increased at a dramatic pace. It's now 18% of our economy is health care. Why has that gone up? A couple of reasons. One, we have an aging population. Aging population has a higher cost to deal with medical coverage. We also have science that people live longer. We've improved it to a certain extent our health to live longer, which means more expensive and longer-term health care is related to that. And I use, the word crisis is a fair statement, because what people are now seeing is if we keep at this pace, in the next half a dozen years to 10 years, it will be an enormous amount of our economy and could cripple our economy. And that's what a lot of us are now seeing, this longer-term picture. And I think that's why we consider it a crisis to deal with it now. Because if you go back, I remember quoting years ago, half a dozen years ago, it was, $700, $800 of what I paid in a premium would go to the uninsured. Now it's $1,900. If you went back and I was doing this recently when I was getting rid of some old tax files from 8, 9 years ago, I looked and I was looking at what the premium cost that I was paying back then and what I'm paying today. And those are all starting to go up at a very, very rapid pace. So it's a crisis because we've not had a full focus on it. We haven't maintained it as well as we should have. We kind of let things just kind of go along, and end result is we're paying a lot more. So that's why, and I guess the point is, if we don't do something now, we'll pay for it down the road. And the last thing I'll say on that is some people want to get the whole thing all at once. We may not be able to do that. We may be able to do a little bit now to help stem the tide of healthcare costs, focus on prevention and wellness, ensure that pre-existing conditions are covered. And that may be a huge stride for us if we can accomplish that alone.
Our next call will be from Sandy in Fairbanks. Sandy, you're now live.
Hello, this is Sandy. Senator Begich, in order to not duplicate services, I have heard you talk about Medicare and Medicaid very well this afternoon. I'm wondering if there is any discussion about having people be able to opt out of it when they have a either private or public insurance program that they are satisfied with and would like to keep using in lieu of Medicaid rather than duplicating efforts and costs.
That's interesting. There has been not any discussion of that. It's more been about the reverse, actually, about increasing right now at 65 and up to go 55-year-olds to 64 could opt into Medicare by buying and paying the full premium, thus lowering the overall cost potential or stabilizing the cost. But no one's talked about taking out people out of the system or letting them opt out. And I think there's a couple reasons. The worry is that you would then potentially cripple the system because people would cherry pick themselves out. So there hasn't been any discussion of people being able to opt out. But it's a very interesting question. I've not heard that discussion in any real form here.
Our next question will be coming from Jerry in Seward. Jerry, you're now live.
Hello?
Yes, Jerry, how are you?
Good. First of all, I want to tell you that you are a fabulous senator, and I work for you hard here in Seward, and I want you to know that.
Thank you.
And you know, my question is, here in Seward, about half the people that go to the hospital have no insurance, and and so those of us that have insurance are paying for it. And I'm just I thank you for your good work, but I'm just real interested in why those of us who have insurance get to pay for people who don't.
No, that's the crux of the issue. And it's interesting. Most people, you seem to be very familiar with it, but most people are not aware of how much we individually pay for the uninsured. I mean, people think, well, they're uninsured, they just kind of take care of their health care. Well, they do. We pay for it. The insured pay for it. And anyone who says anything different is wrong. I mean, when people get ill who are uninsured, they also are the highest cost per participant, meaning that they wait till the end. They wait till they really need the health care. They go in the most expensive end. It's interesting to note the Medicaid program, which a lot of people, who are not necessarily supportive of Medicaid say, well, that's for the low income. Government shouldn't be paying for that. So actually, it's interesting. It costs the federal government total cost per participant per month is $314. That is, if you can find a premium in this system that is only $314, buy it, because that's just not the case. It is a very efficient delivery of service. It's not the best in the sense of some of the inefficiencies that still can be drained out of it, but the issue of uninsured is we're paying for it one way or another. So that is the whole crux of what we're trying to do here is equalize the system, make it fair. Those that are insured can keep what they have, keep the docs they have, but the people who are uninsured, we can start stabilizing the costs for them in the future and also get some result-oriented outcomes with our healthcare system that will take us to a higher par than where we are today in the world of the system of the healthcare.
We'd like to thank everyone for joining us again tonight. We'd like to remind everyone that if you were not able to answer Begich a question this evening, you may leave a voicemail. Please, in leaving a voicemail, leave your address and email address so that Senator Begich can respond to you. With that, Senator Begich would like to make one quick closing remark.
Thank you very much. Thanks all of you for tuning in and taking a little bit of your supper time to hear some answers to people's questions in regards to health care. And I am truly optimistic that we're going to get through the reforms, both health care system and insurance. It will be tough, but there are some tough decisions we have to make here in order to right the system, ensure we have some stability to our health care. And I want to reemphasize those points. The goal here is to ensure that people can keep what they have, they can select the doctors they want, that we get it affordable and accessible to folks, and that we make sure we equalize the system and make it fair. And a couple of the details, making sure that people with pre-existing conditions are covered, that you can move from one employer to the next without to worry about losing your health care or unable to, if you're unemployed, having no health care system while you're going from job to job. So it is a high priority. It's 18% of our economy. It is important that we do something. If we do nothing, the cost will just continue to go up. And for us in Alaska, for the insured, it's about $1,900 a year. We have to figure out how to drive those costs down, stabilize them. At the end of the day, make sure we have quality health care that's based on outcomes, not just how many times you see the doctor. There'll be more to come. Please tune in to our website with our we update it on a fairly regular basis. And also, if you're interested in getting on our newsletter, go to our website and we can sign you up, and we'll be happy to keep you well informed on this issue. Thanks again for all of those that are participating. And again, those in Fairbanks on September 26th at 11 o'clock at the UAF Scheibel Auditorium. I will be there to take your questions in front of you. Have a great day. Have a great evening.